Today we are going to discuss one of important systems of our body, digestive system. Now our body performs different functions daily. For example, our heart contracts 24 hours. We have to take respiration. Our body has to move from one place to another place. So all this work which our body is performing needs energy. So energy that we need comes from the food that we eat. Now food, whether it is from plant source or the animal source, we take that food for the purpose of getting energy for performing different functions. Now there is a problem. The food that's available to us is in such a form that our body cannot utilize it. Basically the food available is in the form of large molecules, and our body utilizes very small molecules of the food. Now what does the digestive system basically does? It breaks down the larger molecules of food into the smaller molecules, and this process is called as digestion. Now but for the digested food to be utilized by our body, it has also to reach our blood. Here again, digestive system not only provides a route for the food to reach our body, but it also transports it to the blood. And this passage of smaller molecules of food into the blood as well as into the lymph is called absorption. So in a nutshell, we can say the purpose of the digestive system is to provide us a continuous supply of nutrients, electrolytes and water. Water is also essential for our body. So there's all these three things: nutrition, electrolytes and water. These are provided us by the digestive system by two main processes, digestion and absorption. Now if we see the functions of the digestive system, there are basically two main functions which we already discussed. One is digestion and second is absorption. Now digestion can further be divided into two sub processes. One is the movements, second is the secretions. Now by movements we mean the movement of the food from mouth to the esophagus, from esophagus to the stomach, and from stomach to the intestines. Unless and until food does not move within our digestive system, it cannot be digested. For example, if we take the food into the mouth and it stays in the mouth, it cannot solve the purpose. Or from the mouth, if it goes into the esophagus and does not move ahead into the stomach, it cannot be acted upon by the digestive juices of the stomach. So the movement of food from the mouth through the intestines, through the stomach, through all parts of GIT is very important. Second thing which is very important for digestion is the secretion of the various digestive juices. Secretions, they contain different enzymes which finally cause the digestion. For example, when the food reaches the stomach, stomach secretes certain digestive enzymes that act upon the food and digest the food. Similarly, when the food moves from the stomach, goes into the intestines, intestines secrete different types of secretions, different enzymes which also act on food, and finally these two processes, movements and secretions, they accomplish the process of digestion. So in the nutshell, if we see the overall functions of the digestive system, these are: number one, ingestion of the food; second, movement of the food through different parts of the digestive system; third, secretion of various enzymes for digestion; fourth is the digestion of food; fifth, absorption of food; and finally whatever is left out which is not useful for the body will be eliminated, and that process is called as defecation, and this is also the process function of the digestive system. Now if we discuss the movements, various movements take place in the GIT, but they can be divided on the functional basis in two types. One is the propulsive movement, second is the mixing movement. Propulsive movements are those movements which cause food to move forward from one part of the digestive system to the other. Second type of movement, functional type of movement, is the mixing movements. Mixing movements help mix the food with different secretions inside the GIT. The propulsive movement, basic propulsive movement of GIT is peristalsis. Peristalsis may be defined as the wave of contraction followed by wave of relaxation which travels in analward direction. Peristalsis is basically a wave of contraction that moves always towards the analward direction, that is from the mouth towards the anus. What happens in the peristalsis? First, that a contractile ring is formed around the gut, and that contractile movement then moves forward and also carries the food along with itself. It's like putting your finger crossed across a tube and then pushing the tube forward. Whatever will be the contents in the tube, that will be propagated forward. This is the peristalsis. Like the diagram I have shown here, you can see how the peristalsis takes place. One more thing which is important related to the peristalsis is that this movement is always in the analward direction. That is, peristalsis takes place from mouth towards the anus. It cannot be in the reverse direction, that it does not move towards the mouth under normal circumstances. Now let us see the second function, that is secretions. So many different secretions take place in our GIT. Let us start from the mouth. In mouth, there is a secretion called saliva, and this is secreted by glands called salivary glands. Then we will come to the stomach. In stomach, there are two very important secretions. One is the acid, second is an enzyme called pepsin. Liver is an organ of the accessory organ of the digestive system which secretes a secretion called bile. Another accessory organ of digestive system is pancreas. This pancreas secretes a cocktail of enzymes, so many different types of enzymes which are very essential for the digestion of the food. In fact, the enzymes present in the pancreas digest all types of food. That is, if we divide the food, it can be divided into three categories: carbohydrates, fats and proteins. Pancreas has the enzymes for all the three groups: enzymes for the digestion of the fats, enzymes for the digestion of carbohydrates, and enzymes for the digestion of proteins. One more secretion which is very important in the digestive system, in the gastrointestinal tract, is mucus. There are so many glands in our digestive system from mouth to anus that secrete mucus. There are single cell glands as well as compound glands that secrete mucus. Mucus is a very important secretion in digestive system. It performs the function of protection. It lubricates our digestive system so that it saves it from abrasions, tear and action of different enzymes. Now you can see the secretions in the nutshell. Various enzymes, these are secreted by digestive system: HCl, acid, bile. These three secretions, enzymes, acid and bile, they aid in digestion. Then another secretion is the mucus, and this, as I said earlier, is the protective secretion. Now we will see the enzymes that are present, that are secreted in our digestive tract. Let us start from the mouth. Salivary amylase, this is the enzyme present in our saliva. Pepsin, this is an enzyme, proteolytic enzyme. It digests the proteins and it is secreted by the stomach. Then trypsin, chymotrypsin and carboxypeptidase. These are three proteolytic enzymes that are secreted by the pancreas into the intestines. Pancreas also secretes pancreatic lipase. These enzymes digest the fats, and pancreas also secretes pancreatic amylase. This enzyme is required for the digestion of carbohydrates. Now let us see the organs of the digestive system. What comprises our digestive system? What are the parts of our digestive system? Before we discuss different parts of the digestive system, let us see the general build of our digestive system. Digestive system is basically a simple muscular tube that extends from mouth to the anus. A simple muscular tube. There are also certain accessory organs that are associated with it. However, this simple muscular tube is modified at various places. At some places, it is distended like a bag, like our stomach. At some places, its anatomy is such that it's coiled, for example our small intestines, and there are certain variations in the internal structure of the digestive system also. Every part of digestive system has an anatomy, and this anatomy or this structure is according to the need of that part. Whatever is the function of that part, it has been given that type of structure, that type of anatomy. This tube that extends from the mouth to anus is also called as alimentary canal or gastrointestinal tract. Now, the organs of the digestive system, these can be divided into two groups: primary digestive organs and accessory digestive organs. Let us first see what are the primary digestive organs. First, mouth, then pharynx. Pharynx is basically a funnel shaped structure that is just behind the mouth. Then esophagus, it's a tube that connects the pharynx with the stomach. It's just behind our sternum. Then stomach, it's a bag like structure. Small intestines, the tube like structures coiled, and finally the large intestines. Small intestine can be further divided into three parts. The first part of the small intestine is called the duodenum. It's in the shape of an inverted C just after the stomach. Then comes the jejunum, and finally the last part of the small intestine is called ileum. Similarly, large intestine can be divided into certain parts. The first part, where the small intestine joined the large intestine, is called cecum. It is an expanded structure. Then ascending colon, the large intestine that goes in the upward direction, transverse colon, descending colon, sigmoid, rectum, and anus. What are the accessory digestive organs? Accessory, these are not the part of the main digestive tract, but they are associated with it, and they help in many different functions of the digestive system. These are called as accessory digestive organs. These are teeth, tongue, salivary glands, pancreas, and liver. This is the diagrammatic representation of the digestive tract. You can see the mouth, then the funnel shaped structure is called the pharynx. The tube that goes down towards the stomach is called esophagus. Then you can see the stomach, duodenum, that inverted C shaped structure, then the coiled portion, small intestines, and then large intestines. First you can see the cecum, the extended part, ascending colon, transverse colon, descending colon, sigmoid, rectum, and anus. Thank you. Now, in the digestive system, we are going to discuss an accessory organ called tongue. Tongue, as all of us know, is basically a muscular structure. It is situated in our mouth. It's whole muscle, and it's covered by a mucous membrane. Now, this tongue, this extends in our mouth from pharynx, upper part of the pharynx, in the oral cavity. So it can be divided into two parts: pharyngeal part, the part of the tongue that lies in the pharynx, and the most of the tongue that remains in the mouth is called the oral part. So we can say there are two parts of the tongue: oral part and pharyngeal part, and both these parts are separated from each other by a V-shaped sulcus. Sulcus means a groove, and this sulcus is called sulcus terminalis. This tongue has the muscles, and these muscles are voluntary skeletal muscles. That means that the muscles which are present in our tongue, they are under voluntary control. They are under our will. We can move it on our will. The length of the tongue is about 3 centimeters, and it is very mobile. You can move it from one direction to another. You can move it upwards, downwards. You can roll it inside your mouth. But despite the fact that it is very mobile, we never swallow our tongue because it's anchored to different organs in our mouth and pharynx. And posteriorly, it's anchored to the hyoid bone. It's a bone found in our pharynx. It's anchored to the mandible, it's attached to the mandible, and it's also attached to the soft palate. Tongue can broadly be divided into three parts: the root, the posterior part that is in the pharynx, body, the main portion of the tongue, and the tip. The body of the tongue has two surfaces: the superior surface, which is also called as dorsum, and the inferior surface of the tongue, which is usually very smooth. If you roll your tongue upwards, you can see the inferior surface of the body of the tongue. You must have observed your tongue on a mirror, and you have seen that it's very rough from on the dorsum, on the superior surface. This roughness of the tongue is basically due to the projections which are present on the mucous membrane of the tongue, and these projections are called as papilla of the tongue, and these papilla give tongue the characteristic roughness. These papilla are of three types. First, circumvallate papilla. These are the largest of the papilla found in our tongue. These are about 1 to 2 mm in size, and their number is about 8 to 12, and they are arranged in an inverted V-shaped form. If you observe your tongue on the mirror, you can see at the back of the tongue, these are the circumvallate papilla are there in an inverted V shape. Another type of papilla which is found on the tongue is called as fungiform papilla. They are in large numbers, and they are usually present on the tip and on the margins. These papilla, fungiform papilla, are identified by their bright red color. You can see on your tongue there are some papilla which are very bright and red in color. The third type of papilla which is present on our tongue are the filiform papilla. They usually cover the central portion of our tongue, and they are smallest of all the three papillas, and they are numerous in number, and it's because of these filiform papilla that our tongue has a velvety appearance, that rough appearance you can see on your tongue. Here you can see the diagram of the tongue showing the fungiform papilla on the tip and the margins, the filiform papilla, and the largest circumvallate papilla in the V-shaped form at the posterior of the tongue. Now, what are the functions of the tongue? The first function which the tongue performs is the function of taste. We taste different many things. We eat food because we like some foods because of its taste, and this perception of taste, this sense of taste, is because of the tongue. Its tongue is the organ which gives us the sensation of the taste. Second important function of the tongue is the speech. We cannot speak without tongue. If a person does not have a tongue, he cannot speak. So this tongue helps in the articulation and in the speech. Third function of the tongue is the mastication. Mastication means chewing of the food. When we take the food and start chewing it in our mouth, the food is chewed by our teeth, but the tongue helps in chewing. It pushes the food always towards the teeth so that it can be properly chewed. The movement of the tongue is very important during the chewing or the mastication. And another function which the tongue performs is swallowing. When the food is chewed properly and is ready to be swallowed, it's our tongue that pushes it backward towards our pharynx. The tongue is lifted upwards and backwards, and it pushes the food into the pharynx. So the tongue also helps us in swallowing. So the functions of the tongue are taste, speech, mastication, and swallowing. Now, if we see the first function of the tongue, that is taste. It's a very important function of the tongue, and taste is a sensation that, along with the sense of smell, helps us to distinguish undesirable or even lethal foods from those that are nutritious. It is the sense of taste and smell combined that helps us in identifying the foods that are nutritious, that are good for us, and also to eliminate the foods that are harmful, that may be toxic, that may be rotten. We avoid those foods because of these two sensations combined, taste and smell. Even our liking of food depends on the taste and smell. Now, 4 different types of taste senses have been identified. These are sour, salty, sweet and bitter. These are basically the 4 primary tastes. Like in colors, we have red, blue and yellow. From these 3 colors, red, yellow and blue, you can make hundreds of colors. Similarly, these 4 primary tastes of the tongue, sour, salty, sweet and bitter, we can appreciate thousands of tastes. All the tastes, in fact, are the combination of these 4 elementary tastes. Now, the taste sensation is basically the function of the taste buds. Tongue is basically a muscular structure. It is covered by the mucous membrane. So, how it perceives the taste? Taste is perceived because of the taste buds that are present in our tongue. The papilla in our tongue, which we mentioned earlier, they contain the taste buds. Taste buds are in fact located on those papilla, except from the filiform papilla. All other papilla have the taste buds. Taste buds are present there. Additionally, there may be taste buds in the on the soft palate, in the epiglottis, and sometimes even we have taste buds in the proximal esophagus also. So it's because of these special sensory organs called taste buds that we appreciate the taste, that how our tongue appreciates the taste, because of the taste buds. Now, if we examine a taste bud, it's basically composed of about 50 cells which are modified epithelial cells. And among these 50 cells, most of the cells are the supporting cells, and very few cells, these are called as taste cells. These are the cells, special cells, nervous cells, which examine or which appreciate the taste. Now, these cells, these taste cells, which are surrounded by the supporting cells in a taste bud, their tips are arranged around a small pore called the taste pore. The tips are arranged in a circular fashion around a pore. And from the tip of these taste cells, small hairs, hair-like projections come out, which protrude into the pore and approach the oral cavity. So whenever we take the food, this food reaches into our taste pores, and these hair-like projections on these taste cells, they perceive the chemical sensation of the food or the taste of the food, and they send the signals to our nervous system through the nerves where we appreciate the taste. So here you can see the taste bud within the muscles of the tongue. You can see the supporting cells and then the taste cells. There are small hair-like projections coming out of the tips of these cells, and they are all arranged around a small pore called the taste pore. So so because of these taste buds, the tongue performs the function of the taste. This is a very important function of the tongue. Thank you. Now friends, we are going to discuss another accessory organ of our digestive system, and that is teeth or tooth. If we see the tooth or teeth in our mouth, the portion that is visible to us, the white portion that is visible to us, is called the crown. But there is also a part of the tooth that is hidden inside our jaw, that is called the root. So the tooth has 2 parts, crown that's above the gums, and the root that lies within the bony sockets of the jaw. And there we can say there is also a third part called the neck, that is a part between the crown and the root. That is a small depression or the narrow portion of the tooth that's called as neck. So the tooth can be divided into crown, the portion that protrudes out from the gum into the mouth; root, the portion that lies within the bony socket of the jaw; and the neck, that is the collar between the crown and the root. Now, if we cut our tooth in a sagittal section means when we cut in this direction of our body, we can see different layers in a tooth. The outermost layer is called the enamel. Now, this is the outer surface of the tooth, and it is the hardest part of the tooth. This part, enamel, which covers the tooth, the outermost layer, this is the hardest part of the tooth, and this is resistant to the acids, to the chemicals, and even to the mechanical pressure. This is basically this layer which protects our tooth and makes our tooth very hard. Now, inside this layer, enamel, is the another layer called dentin. This dentin forms the main body of the tooth, and its composition is almost similar to the bones of our body. So this is also hard, but not as hard as the enamel. So outer layer enamel, then the second layer of the tooth is dentin. Inside this is the pulp or the pulp cavity. There is a small cavity inside our tooth which is called as pulp cavity, and this pulp cavity contains connective tissues, nerves, blood vessels, everything. Basically, blood supply and the nerves are present in the pulp. That's why you have seen that whenever there is some cavity in our tooth, unless and until it does not reach the pulp, we does not feel any pain, because the nerve fibers are located in this pulp. Another layer which we can see in the cut section of the tooth is called the cementum. Cementum is basically a bony substance which lines the tooth socket and holds the tooth in place. You can see this in the diagram. This is a cut section of the tooth. Here you can see the outermost layer, the enamel, the hardest part, then inside the dentin, which resembles in composition to our bones and forms the main body of the tooth. And then the third is the pulp, the innermost layer is a pulp cavity. It contains the nerves which makes our tooth sensitive, and blood vessels that provide nutrition to our bones, to our tooth also. And then you can see this layer that holds the tooth in the socket called the cementum. Next thing which we are going to discuss about our tooth is the dentition. In our lifetime, we develop two sets of the teeth. First is called the milk teeth or the deciduous teeth. These are the first teeth that appear in our life. That's when we are little children or infants. These milk teeth, they are usually 20 in number, and they start to erupt at the age of 7 months and up to 2 years. So they erupt between 7 months to second year of the life. And these teeth, these milk teeth or deciduous teeth, they last until 6th to 13th year of age. These are the first set of teeth which we develop. Second set of teeth is called the permanent teeth. As we grow, the milk teeth are one by one replaced by the permanent teeth. The milk teeth start to fall off, and these are replaced by the permanent teeth. And these teeth then last long in our lifetime. So these milk teeth, when replaced by the permanent teeth, milk teeth are 20 in number, permanent teeth will be also 20 in number. However, there are additional 8 to 12 molars that appear posteriorly in the jaw. Therefore, the total number of permanent teeth that we develop, that we erupt in the later age stages of our life is 28 to 32. So the total number of the permanent teeth is 28 to 32. So we have two sets of dentition: primary teeth or milk teeth and second permanent teeth. Milk teeth are 20 in number, permanent teeth are 32 in number. Milk teeth appear at the age of 7 months to the second year, and they last for 6 to 13 years. Permanent teeth start to appear from 6th year onwards, and they last the lifetime. Here you can see here I have shown you the permanent set of teeth. The teeth in the middle will start from the middle of our mouth, central incisors, then beside the central incisors are the lateral incisors, then canines, then first premolar, second premolar, first molar, second molar, and third molar. So you can count is 1, 2, 3, 4, 5, 6, 7, 8 teeth on this side. Similarly, 8 will be on this side, making 16 in the lower set and 16 on the upper set, a total of 32 teeth. However, in the milk teeth, we don't have the molars, so we will have the central incisor, lateral incisor, canine, first premolar, and second premolar. The number will be 5 on this side and 5 on this side, that is 10 on the lower jaw and 10 on the upper jaw, making a total of 20 milk teeth. Now, what are the functions of the teeth? Teeth perform the function of cutting, grinding and mixing of the food. The teeth cut the food, they grind the food and they mix the food. And for this purpose, teeth they are also provided with a powerful jaw muscles. Teeth combined with the muscles of our jaw, they help in these functions of cutting and grinding our food. The muscles of the jaw provide a very strong force between our teeth for these functions. If you can see here, the front teeth, they create, along with the muscles of the jaw, create a pressure of 50 to 100 pounds. So the front teeth, they mainly do the function of cutting. Back teeth, that is molars, they do the function of grinding, and you can see the pressure is about 150 to 250 pounds. So the function of teeth is to cut, grind and mix the food, and this function is performed with the help of the jaw muscles.
Next is heart failure. If there is inadequate cardiac output is there to meet the demand, that is, the cardiac output is inadequate to meet the demands, this condition is called heart failure. It is mainly due to the left ventricular insufficiency. If the left ventricle is not pumping enough, blood backs up into the pulmonary circulation. Then elevated pressure causes an increased loss of plasma to the interstitial fluid and fluid of the lungs, leads to a congestive heart failure. If severe, can cause pulmonary edema, that is, fluid fill in the air spaces. Cardiomyopathy, that is, cardiac muscle degeneration and fibrosis is known as cardiomyopathy. It leads to again cardiac failure. Now, hypertrophic cardiomyopathy is thickened left ventricular walls. Now, if any damage to the conducting pathways, it causes a heart block, often shows an abnormal ECG. Tachycardia, that is, tachycardias is another condition. Then coronary artery disease, that is, the coronary arteries are the arteries which supply nutrition to the cardiac muscle, can cause, sometimes there may be chance of coronary ischemia, that is reduced blood flow to the heart, and it is mainly due to the atherosclerosis, mainly that is plaques caused by the fatty deposits inside the vessel causing narrowing of the artery. Now, angina pectoris is the pain associated with heart ischemia. The treatment usually done is the vasodilators, beta blockers, CCB, that is calcium channel blockers, balloon angioplasty is done, and in the last stage is the last option is the coronary artery bypass. Now, the myocardial infarction. If there is any blockage in the coronary artery, it causes the coronary circulation stops, and the cells which supplies by the coronary artery may cause damage. It is due to usually it is seen the cases were usually with thrombosis. Now, the blood test for the markers of anaerobic metabolism like lactate dehydrogenase can indicate the heart attack, and around about 25% die before receiving any medical attention, and around 50% die within the first year itself. Women have fewer myocardial infarction, but their mortality rate is higher. The recent evidence indicated that men and women have different kinds of this disease. Welcome back. Now we are going to discuss about the cardiovascular system and exercise. Now, once you are doing an exercise, there are two types of response is there. There may be an immediate response to the cardiovascular system after an exercise, and there may be a later response like adaptation. So, there are two response. The cardiovascular response for an exercise can be divided into two: an immediate response and a adaptation. Now, what are the immediate response? What is happening to the heart rate? Usually, in a normal individual, the resting heart rate is around 60 to 80 beats per minute in a normal individual. But once you see in an endurance athlete, a person who is doing the exercise regularly, especially the endurance training, his heart rate is usually a little bit low. That is, it comes around 40 beats per minute. Now, once a person start an exercise, before an exercise begins, heart rate increases in anticipation. It is due to an anticipatory response mediated by the neurotransmitters. So, before the exercise begins, heart rate increases in anticipation due to mediated by some neurotransmitters. Now, after this initial anticipatory response, once he starts the exercises, heart rate increases in direct proportion and a steady state of heart rate is there, where the demand of active tissue can be adequately met by the cardiovascular system. Now, if during the prolonged steady state of exercise, particularly in hot climates, heart rate increases gradually, this is called cardiac drift. Now, what is happening to the stroke volume? Stroke volume, all of us know, it is the amount of blood ejected per beat from the left ventricle. In a normal person, it is around 50 to 70 milli per beat. During exercise, it may reach up to 110 to 130 ml per beat. But in case of athlete, it's usually the normal is 90 to 110 per ml per beat, and it reaches to 150 to 220 ml per beat. And after this, stroke volume become a plateau. So, again we will discuss, I will repeat it. All of us know that stroke volume is the amount of blood ejected per beat from the left ventricle. So, in a normal individual, it is around 50 to 70 ml per beat. So, while you are doing an exercise, it reaches 110 to 130 ml per beat. But in case of athlete, instead of 50 to 70 as normal, here 90 to 120 ml per beat is the normal stroke volume in a endurance athlete, a person who is doing the regular training. So, once he is doing any exercise, it reaches from 90 to 120 ml per beat to 150 to even 220 ml per beat. And after once it reaches this level, it becomes plateau. Now, regarding blood flow, everybody know the normal at rest, normal systole is around 110 to 140, maximum up to 140, and normal diastole is around 60 to 90 millimeters of mercury. Now, during exercise, systolic pressure may increase up to 200 millimeters of mercury, but diastolic become relatively unchanged. So, normal systole is around 110 to 140 and diastole is 60 to 90. If we are doing an exercise, the systole may reach up to 200 millimeters of Hg, but diastole remains unchanged. Now, regarding the blood, so we were discussing about the cardiorespiratory adaptation to exercise and training. Now, cardiorespiratory changes during exercise and training, and we divided into a short term changes and a long term changes, that is cardiorespiratory adaptation. It is called adaptation or long term changes. So, what are the long term changes? The first one is it causes an increase in the cardiorespiratory endurance. Even it causes an increase in the muscular endurance also. There is decreased VO2 at rest and submaximal exercise and increased VO2 max. There is an increased heart weight, volume and chamber size. There is an increase in the heart weight, volume and chamber size. So, increased left ventricular wall thickness known as this athlete heart. There is an increased left ventricular end diastolic volume, and there is an increase in the plasma blood plasma level also. And there is an increase in the stroke volume. The other adaptation includes there is decreased resting heart rate from an increased parasympathetic activity and decreased sympathetic activity. This causes a decreased resting heart rate. The next is decreased submaximal heart rate. Then there is decreased maximum heart rate of the elite athlete. If your heart rate is too fast, the period of ventricular filling is reduced and your stroke volume might be compromised. And the heart expands less energy by contracting less often but more forcibly than it would by contracting more often. Next is there is a decreased heart rate recovery. Other adaptation includes there is maintained cardiac output at rest and submaximal exercise. There is an increased cardiac output during the maximal exercise. There is an increased blood flow to the muscles. There will be, along with that, there is an increased capillarization of the trained muscles, increased opening for existing capillaries in trained muscles, more effective blood redistribution and increased blood volume, decreased blood viscosity and increased oxygen delivery will be there. There is a decreased resting blood pressure but is unchanged during exercise. Other adaptations include there is an increased blood plasma volume and is greater with more intense level of training. That is, it is maybe due to an increased release of antidiuretic hormone or increased plasma protein which helps to retain blood fluid or increased red cells RBC volume and decreased blood viscosity. There is what are the cardiorespiratory adaptation from anaerobic training? If you are giving an anaerobic training or anaerobic exercise is the exercise where the oxygen is not much used. So, due to anaerobic exercise, cardiorespiratory endurance won't change much. There is only a small increase in cardiorespiratory endurance. There is a small increase in VO2 max also. There is a very small increase in stroke volume. These are the adaptations to an endurance exercise. Now, if you are doing a resistance training, what are the adaptations? The first one is a small increase in left ventricular size. There is a decrease in resting heart rate. There is a decrease in submaximal heart rate. There is a decrease in resting blood pressure is greater than from the endurance training. Resting training has a positive effect on aerobic endurance, but aerobic endurance has a negative effect on strength, power and speed. Now, what are the factors affecting the adaptations to an aerobic training? The first thing and the most important thing is hereditary. Hereditary account between 25 to 50% of the variance in VO2 max values. The second one is age. There is a related decrease in VO2 max might partly result from age-related decrease in the activity level. Gender plays a 10% cause a 10% difference in VO2 max. That is, VO2 max values is of male and female, there will be a 10% difference is usually seen. And the greater specificity training for a given sports activity, greater the improvement of the performance. There will be responders there will be large improvement, and non-responders there will be a small improvement or no improvement among the group of people who experience identical training. So, there will be an individual differences, there will be a group of people who respond positively, and there will be a group of people which we can call them as non-responders. There won't be any improvement by even if you are giving the same type of training. And the greatest specificity of training for a given sports or activity, the greater improvement in the performance. Welcome back. In this session, we will be discussing about the lymphatic system and lymph. All of us know that the lymphatic system is a part of immune system. It's comprising a network of conducts called lymph vessels that carry lymph unidirectionally towards the heart. So, lymph vessels carry lymph unidirectionally towards the heart. So, lymphoid tissues are found in many organs, particularly in the lymph nodes and in the lymphoid follicle associated with digestive system such as tonsils. Now, lymphoid tissue or lymphoid structures, it takes away the excess fluid from and around the cells and return to the blood. So, once the fluid is around the cell, it is called a tissue fluid, and once this fluid comes inside the lymphatic system, it is called as lymph. What are the functions of lymphatic system? The first function is it removes the excess fluid from tissues, and this excess fluid will be returned to the blood. It produces, the lymphatic system produces antibodies and lymphocytes. It clean and filter the body fluids. It transport the absorbed fat from the intestine to the blood. So, these are the functions of a lymphatic system: removal of the excess fluid and returning that fluid to the blood, production of the antibodies and lymphocytes, cleaning and filtering of the body fluids, and transportation of the especially fat from intestine to the blood. Now, what are the composition of lymph? That is the first thing is the protein. The lymph includes protein is there, fat is there, antibodies are there, lymphocytes and waste products are there in the lymph. The protein, its concentration is bit low. When compared to the plasma, the concentration is lower than that of plasma, but place to place the concentration varies. And the second one is the fat. The fat is actually absorbed from the intestine and it is given to the blood. Then antibodies, lymphocytes and waste products are also seen in the lymph. Lymphatic system, it consists of lymph capillaries are there, lymphatics are there, lymph nodes are there and lymph ducts are there. Now, what are lymph capillaries? Lymph capillaries are almost like blood capillaries, but it is larger in diameter and more permeable than blood capillaries, and it is seen all over the body. And the main function is it removes the excess fluid from and around the cell, and it prevents the edema. So, these lymph capillaries remove the excess fluid and drain into the large vessels called lymphatics. Lymphatics is the next stage of the lymph capillaries. It resembles the vein. Why? Because the presence of the valves. So, these valves prevent the backflow of the lymph, and throughout the length of the lymphatics, there are lymph nodes are present. Lymph nodes can be seen throughout the length of the lymphatics. Now, the lymph nodes, these are small oval structures seen throughout the lymphatics. It's have afferent and efferent lymphatics are there. Lymph node is having afferent and efferent lymphatics, and its size is from 1 to 2.5 millimeter. Lymph will passes through many lymph nodes before returning to the blood via lymph duct. So, from the lymph nodes, it passes, then it reaches through the lymph duct. Lymph duct, there are two lymph ducts can be seen in the body, human body. These are right lymphatic duct and thoracic duct. Right lymphatic duct, it carries lymph from right side of the head, neck, cheek and right arm. That is, right lymphatic duct carries lymph from right side of the head, neck, cheek and right arm, and it opens to the subclavian vein. So, this lymph will be transferred to the subclavian vein. And there is thoracic duct. Next lymph duct is the thoracic duct. It drains lymph from left side of the head, neck, cheek, left arm and the whole abdomen and legs, and it drains into the left subclavian vein. Now, what are the functions of the lymph nodes? It clean and filter the lymph before returning lymph back to the blood, and it produces lymphoids and antibodies. These are the functions of the lymph nodes. Now, what is the structure of lymph nodes? It's having an outer cortex and inner medulla, and both outer cortex and inner medulla contain lymphocytes. Some lymphocytes become detached and passed out of the nodes and transported to the blood. As the lymph passes through the nodes, the lymphocytes and antibodies clean the lymph and remove anything which is likely to harm the body. Now, in case of any infection, the lymph nodes become very active. This causes swelling of the lymph nodes and is become severely painful. So, there are different types of lymph nodes are present. There are different levels. The first one is the occipital nodes. It is seen at the back of the neck. Then second type of lymph nodes seen is the submandibular nodes. This is seen on either side of the lower jaw under the mandible. So, there is occipital nodes are present at the back and nape of the neck. Next one is the submandibular nodes are present on either side of the lower jaw under the mandible. The third type of the third site where the lymph nodes are present is the cervical nodes. It is seen on either side of the neck, superficial to the cervical, upper neck, below the ears, deep cervical and middle to the lower neck. Then there are axillary nodes are present. Axillary nodes are seen at the armpit, and it drains lymph from upper arm and upper chest area. And the other lymph nodes are, there are supratrochlear nodes are there. It's seen at the folds of the elbow. Seen at the folds of the elbow and drain the lymphs from the lower arm. There are abdominal nodes are there. It passes the lymph to the base of the thoracic duct. There are inguinal nodes are present, found in the groin, and it drains lymph from the upper leg and the pelvis. There are popliteal nodes seen at the fold of the knee. It drains the lymph from the lower leg. So, lymph nodes are present at this region. It may be occipital nodes, it may be submandibular nodes, there are cervical nodes, there are axillary nodes, there are supratrochlear nodes, there are abdominal nodes, there are inguinal nodes, and there are popliteal nodes. Now, sometimes this lymphatic may get obstructed. So, what is the function of the lymph? It removes the blood from the cells, that is extra blood from the cells. So, once there is an obstruction in the lymphatics, there is retention of the fluid and the tissue swelling occurs caused by compromising of the lymphatic system. This condition is called lymphedema. Now, there is another condition commonly seen is elephantiasis. It is a disease characterized by thickening of the skin and underlying tissue, especially the legs and male genitals. It is due to the blockage of the lymphatic system due to certain worms. So, in this session we discussed about the different functions of the lymphatic system, and what are the parts of the lymphatic, what is the composition of the lymphs, and we discussed about the different lymph nodes and different diseases which affect the lymph.